This is Dr. Anina Abraham from Advanced Retina Care Hyderabad. I'm a retina specialist, and I'm going to be explaining the differences between dry and wet macular degeneration. Now, this is the retina of two different patients. The first one, there is a blackish area in the center of the retina. The center of the retina is called the macula. In the second patient, there is a reddish area in the center of the retina. So this is a dry macular degeneration, and this is a wet macular degeneration. By wet, you simply mean there is either blood or fluid in the macula. Now, the differences between the two are, first of all, a dry type of macular degeneration happens in both eyes, and it causes a gradual loss of vision. Whereas a wet type of macular degeneration causes a sudden loss of central vision, and normally this is seen in one eye first. If the other eye develops, it could be in a matter of time, but normally you don't see it together. A dry type of macular degeneration happens because of degeneration of the area under the retina called the RPE, and eventually the whole macula becomes thinned out or atrophied. So this is a progressive condition. It slowly becomes worse with time, but it takes years to worsen, so you don't have to worry about it, and it affects only central vision. Another thing you see is something called a negative scotoma. It's a blank spot in the center of the vision. When you're reading letters, you see that some of the letters are missing. You're reading something, you find the center portion you can't see. And that's because the center of the retina is missing. It's atrophied. It's completely gone. In a wet type of macular degeneration, because there is bleeding under the retina, there is some amount of distortion of the retina. This is the reason why you tend to see wavy lines and not straight lines. You can see a black spot in the vision, some amount of distortion of vision. All these are symptoms of a wet type of macular degeneration. There is treatment available for the wet type, but not for the dry type. Dry type will slowly progress with time, whereas we can arrest a wet macular degeneration if you take an injection on time. Again, there can be recurrence. Even if it has healed with a small scar formation, you can develop a rebleed with time. But that is something we need to treat. And these days, injections are available to treat wet macular degeneration. So really, there's nothing to worry about. It's only the central vision which gets affected. You will not become blind because of this condition, because peripheral vision is not affected.